Hello and welcome to another episode of AdvoKAYte, Holding Healthcare Accountable. I'm pleased to have Ann Roberts, who agreed to stick around in the studio to continue our conversation. So without further ado, thank you for joining us for another episode of AdvoKAYte, this time with Ann Roberts. AdvoKAYte, Holding Healthcare Accountable. This podcast is my way of sharing what I've learned about the mistakes, the cover-ups, and the ways we can all protect ourselves. We're all in this together. Hello, everyone, and thanks for taking a little time out of your busy days to join us for another episode of AdvoKAYte, Holding Healthcare Accountable. I'm joined today by my friend and colleague and superstar, Ann Roberts. Thanks for joining us again, Ann.
Absolutely. I would not miss this. This is so much fun.
Well, we might be the only two people in the world that think this is fun. And, we hope other people find it interesting and valuable.
Absolutely.
Information. Absolutely. But it's just two old, experienced gals talking about their experience from the trenches.
Absolutely. I say fun because we have that witty banter and we have war stories, but it's also awful. These things have happened, and I love that for this episode, you've entitled it, the deplorables. And we talk about, how Dr. Death, yes, it was widely broadcast. It was awful. Most people know this case. They were outraged by it.
Yep.
But tell me more, Kay, because you've been doing this for a long time. You're a malpractice attorney. Tell me about some of the worst cases that you've seen out there.
Well, it's interesting because we say all the time, Dr. Duntsch didn't create these system problems. They existed a long time before, and they still exist, but we haven't really told people what that means. Mm-hmm. I always preface things by saying, even though I'm a malpractice lawyer, I don't want to scare people because for every Dr. Death, there's 100 really good, well-intentioned, well-trained, good doctors. Mm-hmm. But the system has Dr. Deaths, and those are the ones that we're going to talk about today. Yeah. So I tell this story when I address audiences sometimes about Dr. Death. Mm-hmm. And I go into telling this story about a doctor who's a cocaine-addicted spine surgeon. And I'll tell you the story here in just a minute. But then I say, okay, everybody in the audience, raise your hand and tell me who you think I'm talking about. And they're like, oh, we dummy. You're talking about Christopher Duntsch because that's the lecture is entitled that. And I'm like, wrong.
Right.
I'm talking about Dr. Bruce Hinckley. Mm-hmm. And Dr. Bruce Hinckley, who is deceased now, mm-hmm. Preceded Christopher Duntsch by at least a decade. So, briefly, the story of Bruce Hinckley. Bruce Hinckley was an orthopedic spine surgeon with a practice here in Garland, which is just a little bit east of Dallas, but a suburb of Dallas. And he had moved here from Oklahoma. In Oklahoma, he had had problems because he was found crawling around in a pasture somewhere. It was completely out of his mind on drugs. So what would any reasonable human being do? Move to Dallas and start over. Fresh start. So unfortunately, his cocaine habit continued here. And he was affiliated with one hospital, and he kept having these horrific outcomes. Like, what is going on? Why are all of these patients having these terrible outcomes after these spine surgeries? So the hospital said, we're suspicious, and we're going to start drug testing you. So they began giving him random urinalysis, unsupervised. And he's acing the tests. Clean urine, and yet he goes into the operating room and has another catastrophic outcome. So they say, we're a little suspicious that maybe he's trying to alter the tests. As a side note, when we got into pretrial discovery, we found a insider who revealed that he was getting somebody else I don't remember if it was his office manager, whoever it was, to pee, and he would keep a little vial in a little necklace he had arranged around his neck, keep it close to his body so it would be warm. So he was going in there and putting somebody else's urine in the thing. So they say, look, we need you to come in for a hair sample tomorrow. We're going to collect a hair sample, and, a hair sample is much more accurate and it can go back over time. And he's like, no problem. So he shows up for his hair sample for them to get the hair, and he doesn't have a hair on his body. Like, he has shaved every part, leave nothing to the imagination. Everything is shaved, and certain parts are shaved and bleached. And so whoever it was with the hospital administration, chief of staff or whatever, is like, Bruce, what's going on? Like, you're supposed to get your hair test today. Where's your hair or whatever? And he said, well, this is kind of embarrassing, but, my wife's just kinky and she likes this. This actually came out in the testimony, and it's like, and you fell for it? But they did.
Wow.
But, same story, different day. What happened is every person that Bruce Hinckley operated on got a 360-degree fusion. And these were 13-hour surgeries. Save and except for Bruce Hinckley, the hospital would have gone bankrupt. He was the number one revenue producer. And, probably thanks to cocaine, he was able to go in there and do these 13-hour surgeries day after day.
Just awful.
And so I believe that was the motivation for why they kept him as long as they did. But, as a side note, one of the most interesting depositions I ever took was of his office manager. And his office manager, now mind you, this is a small one-doctor operation, small medical office. Mm-hmm. The office manager comes in, and he looks like central casting from The Sopranos. Mm-hmm. Expensive Italian suit, the slicked back dark hair or whatever. And I had really dug into his background. And he had been arrested in Florida for drug trafficking cocaine. But when he showed up, and it was federal charges in Florida, no one who's your age would remember this, but Janet Reno who was subsequently the U.S. attorney, or the Attorney General, I should say, for the United States. I think under Clinton, I'm not sure. She's the U.S. attorney. Case is called to trial. They can't retrieve the evidence. Somehow or the other, someone got into the evidence locker, and the evidence, the cocaine, had gone missing. So the charges were dismissed. So the person comes to become a manager of a small orthopedic surgeon's medical practice. But this office manager person also had a horse running in the... It wasn't the Preakness or the...
You can't make this up. You cannot make this up.
I'm not making
everything from the bleached skin to...
No, you
to
cannot
the
make these things
Sopranos,
up.
to the drugs being lost, and now you're talking to me about a horse?
Right. He was at, not going here to run, like we have a horse track here in Grand Prairie. There's one in Oklahoma City or whatever. Not that kind of horse racing. I'm blanking on which race it was. It was like the Breeders' Cup. It wasn't Churchill Down, but it was in that category. And I'm like, so, Mr. So-and-so, you also have a horse running in the such and such, and a couple, oh, yeah, that's right, or whatever. And, here's pictures of him standing in the winner's circle. And I'm like, something doesn't add up here. Even a gal from small town Oklahoma can say something doesn't add up here.
You're an office manager. Let's do the math here.
Right. Exactly. Yeah. So that's the story of Bruce Hinckley. I can tell you, many, many years ago, our office was over here in that Merrill Lynch building on Central Expressway.
Yeah.
And, receptionist buzzes back and she said, there's our Dr. Bruce Hinckley here to see you. And I'm like, okay, is it April Fool's Day? Why are they busting my chops like this? And I was like, okay, very funny. Mm-hmm. But, she's like, no, there's a Mr. Bruce Hinckley here. So I'm like, I walked up there and it was him.
Did he have hair?
Yeah, he had hair. He had hair. He was a humbled person. Mm-hmm. And he said, I just wanted to let you know that I've gotten sober. I've been in recovery. And as part of my recovery program, I need to make amends to the people that I hurt. And I can't go to them directly. So I'm coming to you because I want you to please tell them that I'm sorry.
Wow.
And of course, I will never forget that. Mm-hmm. And boy, wouldn't it be nice if Christopher Duntsch called me up from prison one day and said, I can't go to them, but will you please tell your clients, the people that I harmed, how terribly sorry I am?
Wouldn't that be nice? I don't know that we'll see that. Wouldn't it be great, though? You never know. That everything we've seen so far has been quite the opposite, as we saw that, what came out in trial as far as the narcissistic, behavior.
Yeah.
But we talked about Hinckley, and that was, a decade or so before Dr. Duntsch. We can back that up even further.
Yeah, let's talk about the OG.
Yeah,
the original Christopher Duntsch. Let's hear it.
Dr. Swango is who was at the time, and this was probably in the 80s, where he was considered the original Dr. Death. He was a convicted serial killer. And so this physician, and this is back in the day where we didn't have the internet at that time. They didn't have the internet. There was no way to, quickly verify information. It was extremely easy to commit forgery and forge documents and so forth. He went through medical school, so he did complete medical school. He worked as a paramedic at one point and went to jail because he was found guilty of poisoning his colleagues. Patients just seemed to die when he was, under his watch, even as a paramedic. He was in a residency program. Again, same thing. The doctors, the leaders of the program, there were these unexplained deaths that were happening. So he went to another program, forged credentials, had glowing fake letters of recommendation. And he started there, same thing, unexplained deaths. Went to another program, same thing, had used fake credentials, but it was the same credentials. But again, back in the day, they didn't have the internet. But through the grapevine, the program director where he was fired from previously got wind of the fact that he was there. And he called that program and said, he's using fake credentials. We have unexplained deaths. And they said, wow. This makes more sense because we're having the same issues here with these unexplained deaths. And so they didn't have background checks to see that he had previously served jail time for poisoning colleagues. And, there was no internet verifications to say, okay, he absolutely completed training. Clearly, these hospitals didn't do appropriate credentialing where they were back in the day sending paper letters to verify that they completed their, education and training. So then as the police were getting involved and they were doing their investigation, he fled the country. Mm-hmm. So keep in mind, he never finished training, so he never obtained a medical license. He fled the country and he went to Africa. And there he accepted a position as a doctor, and he left a wake of bodies there as well. Mm-hmm. And then the same thing, as the police got involved or law enforcement there and they started investigating him, he again fled the country. However, he was a U.S. citizen, so he had accepted a position as a physician in Afghanistan, I believe, but he had to go through the United States and pit stop here for visa reasons. I don't really understand it from back then. But the FBI, of course, he was on their radar, and that's where they apprehended him, thankfully. So he wasn't able to go to a third country and do the same level of, harm or murders that he did between the U.S. and Africa. But ultimately, they deemed him a serial killer because they estimate 60 patients that he killed, or individuals. He had even poisoned, the girlfriend that had been living with them for a time. There's I don't know if it was a documentary or a movie that actually was entitled Dr. Death back in the day, that talked about this and told his story and everything that had happened. He was convicted of murder, is still serving jail time, has not apologized, is still serving jail time. And I know, a decade or two later, when I started doing credentialing, they wrote a book about this called The Blind Eye. And in that book, it really talked about the importance of doing, background checks and credentialing and verifying references and so forth. And when I started doing credentialing, it was still a paper process. You still mailed out the letters, to the programs, and you had them complete the information and review it. But I would buy, tons of those books, and I would hand them to all of our credentials committee members to educate them on why what they do is so important and why it's not a rubber stamp, and what could happen if, the dots weren't, the T's weren't crossed, the I's aren't dotted, whether you're skipping processes. Yes, this is a high revenue generating individual, so we're going to rubber stamp it. Well, this is what could happen if you do that. And so, it really helped to educate, I think the public weren't as aware as the healthcare industry was in regards to this individual. And so now when we talk about Dr. Death, I can't help but start with Swango. He was the original, at least that I know of, Dr. Death. And I think there was also one in England that may have had more than 60. So
it's horrifying. And I can't tell you how many situations I've had trying to help patients who were a victim of somebody like that. And the doctor came here from another country, and they fled. Yeah. And there's no way that we could ever find them or do anything. But, well, the thing you don't want to happen is for me to start telling war stories, because there's just so many with just doctors who maybe they were good doctors at one point and they just took a hard right turn or hard left turn, or maybe they never were. Maybe they had a character problem all along or something. But, back in the day, and when I say back in the day, this has now been probably 30 years ago, maybe 25, 30. I think it's been 30. I used to prosecute a lot of these pill mill cases. Yeah. And a pill mill, it attracted bad doctors. Bad doctor could start a practice or convert their medical practice into a situation where people come in and say, ouch, it hurts, what would you like? And they would get in cahoots with a friendly pharmacy, and people would begin overdosing and dying. And so I had really the first that I'm aware of, the first pill mill case in the country, and it happened right here in good old Dallas, Texas. And so in this case, this doctor did not end up going to prison, but there was a big SWAT team, that descended upon the medical practice, like you see on TV, how they're taking boxes and boxes of files out of there. But it's a wild story. So you've been to the state fair.
Yeah.
The state fair of Texas is in a very low socioeconomic and dangerous part of town. And, when you drive down the main boulevard there, there's some businesses on either side. So this was a medical practice with a pharmacy attached to it. And it was policed by off-duty Dallas police officers. And so when the clinic would open in the morning, they would open the little door and hand out the clipboard so people could sign in. And then they would open the door, get people in, whatnot. Well, eventually there became, or not eventually, very quickly once the word got out, there became so many people wanting what they had to offer that they just had a system. The first person that would arrive would bring a yellow pad and a pen, and they would just pass it around the parking lot. Mm-hmm. So beginning at 2 or 3 in the morning, cars would start showing up at the medical office, and people would be laid out on their hoods or whatever, and whoever was the keeper of the clipboard was this honor system. Mm-hmm. Fist fights would break out in the parking lot because they would be like, no, I was number 17, not 19. Mm-hmm. And they would run through, I don't remember now, but hundreds of patients a day. So what would happen is over time, what drugs were popular changed. But back then, it was a cocktail of hydrocodone, Soma, a muscle relaxant, and Valium. That doctor was the number 1 prescriber of Valium in the state of Texas out of this little podunk medical clinic. Wow. But, and cough syrup. If you went in and said, you would get the codeine cough syrup. And there was actually a song made about it. Somebody made me aware of it, and it was called Sip and Sizzip.
I've never heard of that, but now I'm going to have to look it up.
Yes. And it's because the codeine syrup was a good high, I guess, especially in combination with these other things.
Yeah.
But, no pill-pushing doctor is any good without a pill-pushing pharmacist. So there was a little breezeway. So the patients would get their prescription and go over to the pharmacy. Well, the pharmacist and his crew would get there in the morning, and they already knew what prescriptions they were going to be filling. So they would just start pre-filling them, and they'd have them all lined up. Here's the Valiums, here's the muscle relaxers, here's the painkiller. And so then that way all they'd have to do is print the label, and, they can keep the people going. And, we had witnesses saying, like the Cardinal Health trucks pulling up, just, unloading drugs. And as a happenstance, I knew somebody at the time who lived in Santa Fe, New Mexico, highfalutin Santa Fe. And this friend called me one time, a friend from college, and said, don't you have a big case? Aren't you representing a bunch of people against this so-and-so doctor? And I was like, yeah, why? And he said, well, he is parading around the plaza in Santa Fe in his full-length mink coat, and everybody knows him around here. He's just notorious, And I'm like, well, I'm sure he is flaunting around in his full-length mink coat because he's making, a fortune out of that. But that case really sparked the awareness and went on to me having a big case in Las Vegas, which I'll talk about later. So that was the very first case, and that led to me having many other cases, including a notorious one in Las Vegas, where that doctor's brother was a lawyer and ended up suing me in federal court in Nevada for libel and slander. So let me stop telling war stories. Well, I spoke the truth on the television. Mm-hmm. I said that doctor was using his prescription pad as a printing press to print cash.
Yeah.
And they took offense at that and sued me. Mm-hmm. So that was really fun.
What was the outcome?
But I got out of it.
As you should.
Truth is an absolute defense.
Absolutely.
It's a slander.
Yeah.
So, well, let me put it back on you. Tell us another horrifying story.
Well, we can jump ahead decades, right? And so I think we're both aware of a more recent one. Again, here in Dallas, not to pick on Texas, not to pick on Dallas,
right.
But this was another horrific case. And when we look at Dr. Reynaldo Ortiz, who was an anesthesiologist working out of a couple different ambulatory surgery centers, he, had spiked the IV bags for a significant number of his patients. Fortunately, they were in the ASC, so they were able to be resuscitated, but not without harm, of course. some permanent harm. And it was really unfortunate. One of his colleagues took an IV bag home and immediately died because of the fact that he had put this cocktail in that IV bag. But when we take a step back and we say, well, how did this happen? And, I really dove into this case to say, okay, like, how did this happen? What really led up to this? And we talked about in the last episode, how, maybe they were good doctors at one time and things happened in their life that, made them change, overall, or they could have just been bad all along. Well, this is one of those who they were bad all along. Yeah. And the hospitals or that own these systems, the ambulatory surgery centers, they should have known. They did know. Mm-hmm. And that he was a violent criminal who they allowed to continue to operate. And so when I dug into his background, it went back 20 years where he had been arrested for domestic violence. And then, 10 years after that, he was arrested again for domestic violence. So clearly a violent criminal that you wouldn't want to have as a part of your medical staff operating on your patients, but also putting your organization, putting liability on your organization and your employees and everything else. Why would you want somebody with a violent criminal history there? And then you take a look at the medical board and the actions taken, and there was this long list of action by the state medical board where they, had slapped him on the hand, is what I call it, when they put in an agreed order. We're going to give you a fine. We're going to send you to, some classes. The second order, after the second domestic violence arrest, he was required to not carry a weapon. He was required to comply with his probation, his criminal probation, and he was required to have drug testing. So as you can read between the lines in this, whatever the domestic violence was, a weapon was involved. He was clearly abusing drugs. He was an anesthesiologist, so of course had it readily available to him. And then 2 years later, just as he was wrapping up, or had just wrapped up the last slap on the wrist order, he finished his probation. The second domestic violence victim had a neighbor that had helped her throughout this process. And in retaliation, he shot the neighbor's dog. Right. Which breaks my heart because my dog is my baby. Yes. So every time I just hear that, I just, it's awful. It's just traumatic. And he still continued to operate at these ambulatory surgery centers. And I couldn't wrap my mind around this. Why would you allow somebody to do this? Were you not doing criminal background checks? And when you broke it down even further and you look at the transcript from the hearing, there was documentation presented that stated that he had his privileges revoked at one ambulatory surgery center due to poor patient outcomes related to, resuscitation and so forth. Again, he's an anesthesiologist, managing difficult airways. Well, then he was allowed to continue to practice, and an office manager, I believe, testified, well, he was friends with the CEO. So they allowed him to continue to practice here and continue to participate in operations. And so then, you see what the end result was. He ended up taking that violence into the workplace and harming patients. And he was caught during this time because if it's a pattern, it was in a short period of time, but who knows what else he did in that 20 years because he was a violent criminal participating in patient care for patients in the operating room, managing a lot of dangerous medications. And so when you hear stories like that, you have to, again, take a step back and look at the system that allowed this to happen. Yes. It's public information. You can go to the Texas Medical Board website. You can see all of the information, the orders, the criminal charges. And so that's one more deplorable, horrible story that is more, recent. It was within the last couple of years. Sentenced to jail, thankfully. So, prison.
Yes, and I cannot remember what his sentence is.
It was life. It was 90-something years, but ultimately it was life in prison.
And I can't remember if he's in the same facility as Duntsch, which would be very interesting.
Oh, we need to look at that.
Yes, we do.
Yeah.
We might need to go down there and
I
pay a
agree.
visit
I agree.
sometime.
Yeah.
But it's really crazy because I think I could foresee a situation in my own mind in a deposition where, some hospital administrator or something would say, well, these were incidents. I mean, just because somebody shoots the neighbor's dog or whatever doesn't mean that they're a dangerous physician, but there's lots of personality type issues that are cast off as, oh, that doctor's just a prima donna, or that one just has an anger issue, but it doesn't affect patient care. But in fact, it does.
And I think this is going to go back to our prior conversations of, do you have a culture of patient safety?
Yeah.
Is your organization led by that, driven by that? Because immediately there is no justification for having someone like that on your medical staff. The soon as you know that somebody has a violent criminal past, that would be an immediate investigation.
Yeah.
And I can't fathom being in a healthcare system or ambulatory surgery center if they knew about this, that would continue to allow somebody with that violent, long history, 20 plus years of criminal history, violent criminal, continue to treat patients. It was completely preventable had they just, looked at also the state board. Had the state board taken more concrete action, they actually did not revoke his license until they were informed that he was under federal indictment.
That sounds about right.
Yeah.
And, we're deep diving on the medical board as well. So I'm going to resist the urge to run down that rabbit trail. But, to your point, judgment is judgment. And clinical judgment. Can you be a person who has horrific personal judgment and be a safe physician that has impeccable clinical judgment? I don't think so. And it reminds me of a story. If you've practiced law for, I guess, almost 40 years like I have, you can't help but tell stories. But we had an evidentiary battle in a case because this neurosurgeon had been sued for sexual harassment. And the evidence in that sexual harassment case came out that he gave somebody on his staff a sex toy at the holiday party from Dr. Love, and he wrote on it, like a Sharpie, wrote on the sex toy, Dr. Love, or something like that. And it was kind of funny because Ben, our senior associate attorney, it was like his first week on the job, and I was like, why don't you tag along to this deposition with me or whatever.
Poor Ben.
And so I whip out this picture of this sex toy that says Dr. Love on it, and I don't remember the line of questioning, but it was basically, before I whipped the picture out, we talked about medical judgment, clinical judgment, how important it is to have the right mindset to make good clinical decisions. And then I showed this, and I say, do you agree that this was poor judgment, poor decision making, and yet you're going to tell the jury, this is the kind of decision making I make personally, and yet my clinical decision-making is perfect. And we had a big evidentiary fight about it because they were like, that doesn't have anything to do with it. And I said, it has everything to do with it.
Everything. Yeah.
So,
and that's a really great point because, one of the, ultimately, again, going back to the responsibility of physician leaders and organizations is there's professionalism. There's moral character, making sure that they're upholding ethical standards. And I don't think anybody could look at that and say that they're a outstanding citizen, which is required. Almost every set of medical staff bylaws says in order to qualify to be a member of the medical staff, you have to uphold, and be of good moral character. You can't have crimes of moral turpitude. I mean, the word is in there and built in and baked into everything about physicians, that they have to have, ethics and standards and professionalism. And so it's not about just, are you able to provide good quality care? It absolutely is linked to that, because then you're not professional. And if you have that type of judgment in your personal life,
right,
that's likely bleeding into your professional life, because then you're looking at potential sexual harassment in the workplace, unprofessional, just
just
I could go on and on.
lots of things.
Yeah.
Lots and lots of things.
Yeah.
But, and you and I could go on and on and on and on. And, I have a captive audience here with you. So you're so gracious to let me tell all my old war stories, which are, once you get me rolling, I could tell 100, but I won't. So, I was just sitting here thinking, what I really want to hear is from the listeners. Like, did you like hearing stories like this? And do you want to hear more stories? Or, do you want us to talk about more of the nuts and bolts of patient safety? Because, I want to have you back again and again. And I know I speak for you as well. We're doing this because we want to help. We want to educate people. And, maybe sometimes we take a break and we just kind of entertain a little bit. Maybe we're just entertaining ourselves. But
no, I agree. And we have a long list, with our advocacy team. We know that we're just touching the tip of the iceberg with these stories that we just told. And so, absolutely, I think that we could go on and talk about so many that we have seen, in our work, especially, through the malpractice field, through the advocacy work that we've done. And it's just really unfortunate. And our goal is to educate the public that these things do happen. They continue to happen. Despite these awful cases throughout the decades, the system is still continuing to allow it to happen.
It's the system, it's the system, it's the system. And I'll end it here. One of the great privileges of my entire life, my entire career, is I was interviewed by Dan Rather. And what a wonderful human being. Yeah. And he was asking me some questions about, this was a pill mill case down in Beaumont that made the national news. And he was asking me about the motive. And I said, well, I think it's financial. And he told me then off the record, he said, I don't think he said young lady, but words to that effect. He said, as a cub reporter, I was always trained to follow the money. To try to get to the root of the story, I would always be told, follow the money. And it's not always the money, but I'll just say there's a common thread with a lot of these cases that it's a follow the money.
Yeah, that's so unfortunate.
Yeah. Well, thank you. And we look forward to having you back again.
Absolutely. Thanks for having me. I look forward to coming back.
You bet.
All right.
Thanks, everyone, for joining, and I hope you'll join us for another episode of AdvoKAYte. Please don't forget to subscribe to our YouTube channel, follow us on Instagram, tell your friends, family. If you're a healthcare worker, particularly someone like Ann, who's in administration, wants to be part of the solution, a physician, a nurse, please reach out. You can direct message us on Instagram. You could reach me directly. My email is my initials, kvw@vanwaymetzler.com. I have people that find my cell phone number and reach out to me all the time. I always respond, or people email me and introduce themselves and say, I want to help. If you think you have something to contribute and you want to be a guest on the podcast, get in touch. We would love to have you. So thanks again for listening, and we'll see you next time.